A lot of patients ask me, what's the best operation for breast augmentation? And I think that in actuality, any of the incisions that we use are really fine. Putting it very simply, there are three main ways of putting in a breast implant. An incision underneath the breast, which we call inframammary, one at the edge of the areola, which is a periareolar, and one in the armpit, which is called an axillary. So we pick different incisions for different patients based on a number of different things. One of them is the yuck factor, like where will you not accept a scar? If you really like to wear sundresses and you have exposed arms, perhaps that scar in the armpit may become more visible when you don't want it to be. If you are afraid that a bathing suit will ride up a little bit, that inframammary scar, though usually it's pretty good, can sometimes get in the way, and that tells anybody standing in front of you that you've had some help. A periareolar incision is really only seen, when done well, when you really want it to be seen. So the decision in large part is you. Now, are there times that we use other criteria? The answer is yes, of course. If you're really concerned about breastfeeding at a later time, I might not want to do an incision right next to the areola because that could damage the structures that are necessary to make milk. If you have a tendency toward bad scarring, I might be inclined to go through the armpit. If you have a very well-developed inframammary fold where your breast hooks back into your body, I might choose that because it'll hide it within the fold. So there's no simple answer. All of these incisions are good, and they're all based on what works for that particular patient. I hope that answers your question.